Why don't we start with this question of the schools? Obviously, parents would like to see their kids go back to school, but they would also like to make sure that their kids are safe in that scenario. What would you be thinking as a governor, knowing that the president wants you to reopen these schools? I would imagine that governors would like to reopen them, but every governor is dealing with a different situation in terms of what the caseload is in his state.
Right. Thanks, Becky. We've long talked about on this show the importance of getting the schools open in the fall, not only because of the social and the educational benefits to children, but you're really not going to be able to restart the economy until you're able to open the schools more fully. I think the way to achieve that is to try to get resources into the schools that they can use to better protect the teachers in particular and also the children, proper PPE, protective equipment for the teachers, testing in schools. Different school districts are looking at testing. I also think it's important to give local discretion to districts, give the districts discretion to make decisions based on their local infrastructure. There may be schools where you can't properly distance, crowded schools that don't have the same physical infrastructure, where they might want to go to a schedule where they have 1 or 2 days of distance learning and 1 or 2 or 3 days of in-classroom learning. That might be appropriate for certain districts where you see a lot of spread and certain schools just don't have the same infrastructure and resources as others. So giving discretion to local districts to make decisions based on what their resources are and what the local situation is, I think is going to be important to keeping schools open this fall.
You think there's any governor who actually wants to keep the school closed for political gain?
I've talked to a number of governors about this question, both Republican and Democrat, and they all want to open their schools. Different states are adopting different measures. Here in Connecticut, they may require the wearing of masks by children. They've looked at testing around the schools, trying to test both the kids and the teachers on a regular basis. Massachusetts has looked at some of those issues as well. Maryland has done the same. So when I speak to the governors, they're all pretty focused on trying to get the schools open. They realize the importance of opening the schools to the kids and also to the economy. Kids have been out of school now for an extended period of time. Distance learning didn't work that well in many states. And this does have a detrimental effect on kids, on their social well-being and their educational advancement.
Doctor, that's actually the argument, as you know, that the American Academy of Pediatrics made, really on behalf of why children should go to school and why that should be the goal. And I think it is the goal for so many of us, including parents who would like to see their kids back because of both the learning issues and social issues and so many others. The question I'd ask you is, there are so many different studies going on around the world trying to ascertain whether children not only get it, but let's even decide that they're low risk unto themselves, which I think they are, but whether they spread it. And you look in certain places like Israel, and there's an example where there clearly was an outbreak. You look in places like Denmark, and they will tell you that they've done a great job and haven't had problems. You look in that, and there's that Paris example, or in France example, where things went very well, but then there was an outbreak in Australia. Is there anything that you can ascertain from that where you say to yourselves, that kids are going to spread it or aren't going to spread it? And why don't we have better data on that at this point?
Look, this has been the challenge. There's data on both sides of this debate, and this debate's pretty intense. There's people who feel very strongly on both sides of this question, and you can find a study to support your position depending on what your position is. The challenge is that we really haven't studied this systematically. So countries that did open their schools, like Sweden, really didn't study what the impact was in terms of what the infection rate was among kids. There aren't good seroprevalence studies. There was one study in Geneva, a seroprevalence study, looking at exposure to the virus among children. It found lower exposure for children 5 to 9, but then equivalent exposure for children above the age of 9. There was another seroprevalence study done in Spain, a large one, that looked at younger children and older children and found the prevalence was about 2.8% in the younger kids, around 3.5%, if I remember correctly, in the older kids. So a little bit lower than the rate of infection in the general population. Here in the United States, it's probably the case, and we don't know. There's a study underway by NIH. But it's probably the case that the exposure of children to the virus has been lower than in adults because we deliberately sheltered the kids. The first thing we did was close the schools. But we don't know the answer to that question. And so that's what makes this so difficult. People make comparisons between COVID and flu and say not a lot of kids have had bad outcomes with COVID, and that's true. And COVID does appear to be less risky in kids than it is in adults. But with flu, you get 11.5 million kids who become symptomatic each year from flu. That was the 2018-2019 flu season, and many more became infected, and that's with a vaccine. We haven't had that many kids infected, hopefully, with COVID when we do the seroprevalence study. Certainly 11.5 million kids haven't developed symptomatic COVID. So you really can't make the cross comparisons between the experience in flu each season, where it becomes epidemic in children, and the experience in COVID, where it's probably the exposure has been low so far in kids.